Hi, I'm Dr. Mohammad Suhail, and we have started a series of talks on leadership traits. We'll talk about the level two leadership in this talk. We know that leadership is often described as a journey, not a static thing. So, there are levels, and we have already discussed the level one, which is the positional level. People follow you in the position level because they have to. There is no option for them to disagree with you. However, true leadership begins at the level 2. Why? Because this is called the permission level, where the people allow you or permit you to do to be their leader. People follow because they want to, not because they have to. So the defining feature of level 2 leadership is relationships. A level 2 leader invests in the people. They communicate with the people, they interact with the people, they are involved in the issues of the people, they value their perspectives, builds trust through consistent respect and integrity. It is no longer about giving orders. It is about creating an environment of trust where collaboration and commitment flourishes. So, in healthcare, also, this form of leadership is particularly critical because there is patient safety and because the success of our works relies on multidisciplinary teamwork. We cannot work alone. So, this is a teamwork and trust on each other which delivers a safe and qualitative healthcare. So I will share some examples. For example, in the emergency department, a physician leader who acknowledges the stress and workloads of the nurses and shows appreciation of their decisions and supports them in difficult cases. He or she earns trust. As a result, nurses become more willing to go to the extra mile, not because they are told, but because they want to. They build their trust with their leaders. So they have made a bond within them, within the team. I give you another example. A surgeon, a consultant who explains operative procedure to their juniors, also explain the positions and the requirement of the patient during the surgical procedure or before the surgical procedure or after the surgical procedure to the unit where the patient is admitted and inpatients. It encourages them to appreciate their contribution, demonstrates level 2 leadership. So the juniors, whether they are the doctors, nurses, or subordinates, they respect them, motivated, and they are committed to patient care as a team, not alone. Now I give you another example. A hospital administrator, whether at the director level, hospital director level, department head level, nurse head level, a quality led head level, who listens to staff concerns about a new documentation policy, adjusts the process after consultation, show relational leadership. They listen to the policies, clinical pathways, guidelines, guide them how to execute them, guide them how to come out of their issues in these difficult times. Staff buy in is achieved not through enforcement but through inclusion and respect. So at this level, leaders learn the people that people do not care about how much they don't know, but people care how much they do care about them. This is the essence of level 2 leadership. It sets the stage for higher levels. driving results, developing others in continuous mentorship, and making a culture of excellence and teamwork. So, we conclude this talk by saying that level 2 leadership reminds us that the trust is the currency of influence. In healthcare, where lives matters and they depend on cooperation and clear communication, this level is not optional, it is mandatory, it is essential. So we have to move from the first stage to the level 2 leadership. Leaders who build strong relationships create teams that are resilient, motivated, and capable of delivering safe, compassionate care and a high quality outcome. So this ends our talk for level 2 leadership, which is the permission level leadership, where your subordinates, your staffs give you permission from inside their heart, inside their mind, that you can govern them. Then you can be their leaders, and they don't obey or comply with you for that they have to comply. No, but they have to comply because from inside they are convinced with your communication, your trust, your capabilities, and your skills as a leader. So, thank you for now, and we will explore the other levels of leadership in other videos, inshallah.